So how do we apply this CPAP? We've been talking about all these things. How do we actually apply it? So the first thing to do is you need to calm your patient down. They are having respiratory distress, they're panicking, and you're about to put a mask over their breathing holes, over their face. This mask is big. It's a whole face that's going to be scary as heck for this patient to have this occur. So you need to coach them and calm them down. In fact, one of the nice benefits of being a paramedic when we use CPAP is that if I really need to, I can give them a medication to help them calm down a bit before I actually apply this. However, the same principles still apply, though, is that we need to coach them about what we're going to be doing, how to breathe, how to relax. We need to get them sort of zen, calm down. We need to do this.
Come on, Alan. Positive thoughts.
That's a good life lesson. Think positive thoughts, right? Say that to your patients. So we need to coach them and calm them down. That was, by the way, to give the appropriate credit to that, the copyright sort of thing. That was a clip from Entourage. Apply your mask and you're going to tighten the mask to create a seal. We need this to be a perfect seal because we're creating pressures, and pressures with any leaks will completely diminish the ability for pressures to accumulate. So you will tighten your straps so that it's nice and tight across the face. Then you're going to attach the tubing to the oxygen here. So you'll attach that tubing and you're going to turn it on. Remember, we talked about this. If there's any dust in here or in here, I want that to get blown out before I apply this to the patient. So now they just got the mask on. You've got all of this attached to the oxygen running through, and then you're going to turn on the oxygen, like I said, get all that dust out. And you're going to take this part and actually plug it into this big hole right here. You'll see that this piece fits into that small piece there. Then you need to set the PEEP. So this is by increasing this. When you increase the liters per minute, you're going to increase the PEEP. No, not that PEEP. This PEEP. You're going to see your PEEP again on the exhalation at the end of when they breathe out. Where the dial is the PEEP. So you're going to start at 5. 5 is a good place to start with. If you need to, you can upgrade to 7.5, and then you can even go up to 10 if needed. And that's measured in centimeters of water. CmH2O. And there's a certain flow liters per minute associated with the PEEP. Now, really important is the continued assessment. All right. This is incredibly important, as I talked about. You need to absolutely keep a very close eye on their mental status. You need to make sure that you're checking their blood pressure every few minutes. Keeping a good finger on their pulse, because pulse can tell me sort of how their blood pressure is in terms of the strength of the radial pulse. If I start to get that diminishing or becoming weaker or gone, I'm going to really be checking that blood pressure again. But we're checking blood pressures constantly. Abdominal distension, make sure you're looking for this. If you see it, you'll literally start seeing their abdomen distending and filling. Make sure you're paying attention to that. Ask them how they feel. Is this making you feel better, or is this making you feel worse? They'll tell you, and have them give you a thumbs up or a thumbs down, because they're going to have a hard time talking. It's quite loud. So they'll tell you. And if they're saying no, then understand that makes them probably feel like they're having to work harder to breathe. And that might be going into that situation where the muscles are getting too tired, and maybe CPAP is not good for this patient. You're going to tire them out before the effects of it can really kick in. Make sure that you ask them how they're feeling with this. Note their work of breathing. You'll see whether it gets easier or harder, and you'll see that significant reduction or increase of the accessory muscles and all of the other signs of increased work of breathing. You're just assessing all the vital signs frequently. Again, you have increased significantly the risk and the risk reward sort of benefit on this patient. So you're constantly assessing these things to make sure that your CPAP is still being beneficial, not a risk or a problem. And that's it. That's CPAP in a nutshell, y'all.